Hi, my name is Christina Herrin, Government Relations of Health Policy at the Heartland Institute, and today I have Bethany Marcum of the Alaska Policy Forum to discuss with us the last legislative session of this year and what Alaska has been working on in regard to policy reform over the last 6 months. So Bethany, thank you again for coming on and talking with us today and giving us an update on Alaska.
Well, thank you for having me, Christina. We're excited to talk to you. Alaska's had a lot going on, so we're eager to share.
Yeah, so just to be accurate here, the Alaska session is up, but there are still some special sessions, or could you talk a little bit about where the timeline is on that?
Sure. The second special session just ended, I guess, yesterday, but there is at least a third special session and rumors of a fourth special session. So they've more or less been in session since mid-January. They went directly from the statutory 90-day session to the constitutional 120-day session. And then after that, they had a couple days off before they went directly into session one and then session two and just finished session two. For sure, there's another session in August. That's been one where they were called by the governor, but there could be another in the meantime, from what we're hearing.
Okay. Awesome. Have you guys seen any great legislative wins that you want to share with us that the Alaska Policy Forum has, advocated for?
Yes, the one legislative win that we've had is COVID related. We're very excited about that. And that is protection of businesses in Alaska from COVID liability claims. So a lot of other states passed this kind of with their departure legislation whenever the pandemic hit in March and April of 2020, but Alaska did not include that. So we've been advocating for that and educating the public and business owners on that throughout last year and throughout the legislative session this year. And we were really happy that protection was not only passed for small businesses so that they don't have to worry about getting COVID liability claims if they do their best to comply with the regulations and the rules regarding keeping their business and their employees and their customers safe. But in addition, the language that got passed in Alaska was retroactive into March 2020. And so that really provides a measure of a reassurance for business owners that they will be able to conduct their business, open up fully, and not have to worry about those sorts of lawsuits coming in, which could sink them during a particularly vulnerable time.
Yeah, for sure. Well, that's great to hear that Alaska made those steps. I also want to just note, I know certificate of need law has been attempted multiple times in Alaska, or reform of certificate of need law has been attempted multiple times. And I know this legislative session, we testified a couple times on some certificate of need reform, but unfortunately that didn't pass. Do you have any updates on what happened with the con bills?
No, it's the same as with a lot of the other good pieces of legislation that were introduced. So a lot of good policy was put aside this year because of the fiscal discussions that were going on. Alaska has some serious fiscal financial situations going on with the budget, the changes that had occurred, the instability that there has been in oil prices, which drives a lot of the revenue for Alaska, and some internal kind of state central discussions regarding our permanent fund dividend. And because a lot of those discussions, some of the other good policy was put aside because legislators ended up having to devote so much time and energy to these fiscal issues. But we're really hopeful that will change in January.
Sure. We're usually talking about healthcare policy when I do these interviews with you, but is there any other policy area that you saw noteworthy legislation come from the Alaska legislature?
Yes, one that was introduced and it had very robust committee hearings in the Senate, and we're hopeful that we will see action on the House, is what we call our Read by 9 policy. It's an education policy, creating some reforms which ensure that our third graders, actually our kindergarten through third graders, learn to read to the sufficient level that they are able to use that foundational reading to learn for the rest of their academic career. This is a reform that was initiated by the state of Florida under Governor Bush some years ago. Mississippi has had a lot of success with this, and many other states have it in place, but Alaska's children are still ranked last in the nation regarding reading and literacy. And so it's an issue that we feel is central to reforming Alaska's education system. And like I said, there was a very good policy reform that came out of the Senate this year, and we're hopeful that we get that moving in the House next year.
Yeah, well, that's great. And there's definitely been a lot of education reform in all the states that has passed that I've been really impressed with. So that's just another one to add to the list. Does Alaska Policy Forum have any specific priorities from next year that you're seeing kind of on the horizon, or any other just legislative issues that are important to Alaska that you're seeing in the future?
Yeah, so the Read by 9, third grade literacy policy is our top priority, most certainly. And some of the ones that you and I have talked about in the past that affect healthcare are also on the menu for us, and that would involve a certificate of need repeal, direct primary care, which is one that we think is really central to providing more access to Alaskans, and also expanding licensing of for telehealth providers from across state lines. There was just an article in KTOO, which is the public media outlet here in Alaska, about the many patients in Alaska who've lost access to their specialty doctors in Seattle. Alaska sometimes doesn't have all the specialists that we need access to, and so patients will see medical providers in the Seattle area, since it's kind of the next closest big metropolitan area to us. And a lot of the patients have lost access to those medical providers now because the telehealth licensing across state lines that was in place temporarily during the pandemic has expired, and now they're not allowed to do that. And so this is another one of those reforms that we really hope to see to give Alaskans better access and help drive down the costs of healthcare.
Yeah, I think direct primary care, certificate of need, and telehealth expansion are like three of the top, pieces of legislation or reform that we've seen come out of, this COVID-19 pandemic. And a lot of the states, rolled back those regulations temporarily. And, some states did actually decide to permanently repeal or roll back those regulations. So I do hope that Alaska does try again for their reform, and we'll definitely be backing telehealth expansion and direct primary care expansion and certificate of need reform in the state. So is great to hear that there's potential for that. Are there any other legislative issues that you want to know, or anything else that the Alaska Policy Forum is doing?
Well, the other ones that we're looking at are kind of longer term policies that we're working on, and we know, based upon what's happening with the legislature right now and their embroilment with the fiscal issues, that some of those things are probably going to have to wait in terms of letting them get this issue resolved before these other things get attention. And so really all eyes right now in Alaska are on this fiscal situation. We don't have a long-term sustainable fiscal plan for the state, and the economy, business owners, and the public need to feel that that's in place. And then there's probably going to be the bandwidth for discussions on more sorts of policies. So the ones that we've talked about, healthcare and education, those are some of the ones that are more have more pandemic ties to them, and therefore there's more momentum for those. There's a lot of other bills that have been introduced that we're interested in, but we really do get the sense that legislators want to resolve this fiscal issue before there is a lot of movement on some of the other kind of what's called personal legislation and policies.
Yeah, I mean, that's completely understandable. And then for those of you out there that want to learn more about certificate of need or direct primary care or telehealth, of course, the Heartland Institute is always putting out research and commentary regarding these pieces of legislation. And then the Alaska Policy Forum, what's the best way, Bethany, for folks to just stay up to date with the work that you all are doing?
Yeah, so our website is alaskapolicyforum.org. We have two places on there where you can sign up for updates from us. You can get our newsletter, so you can sign up for that on the website. There's a place that says sign up for updates. Once you do that, there's two places for the newsletter, and then you can also just sign up to get blog posts. So everything that we post, whether it's a policy brief or whether that's a news article, everything that we post, you can get those emailed directly to you as well. So there's a couple different ways to stay in touch with us, and then we also have your standard Facebook and Twitter accounts also, where much of the work that we publish is distributed.
Great. Well, I really appreciate your time, and just thank you for sharing the legislative wrap up for Alaska. And I really hope that in the next coming months, when we circle back to the next legislative session, that there's some more support behind some of these healthcare pieces of legislation. Of course, the ed policy that you all are working on too. That's phenomenal. So I really appreciate the work that you guys do. It's just great. And for those out there listening, we'll link the Alaska Policy Forum's website below, so you can continue to check out the work that they're doing.
Well, we appreciate the opportunity to discuss it with you, and always to partner with you and Heartland on these issues, Christina. So thank you for being a great partner with us, because it takes a lot of minds to put together the information to make the case for why these policies are important. And it's great to have partners like you.
Yes, absolutely. Well, thank you so much, and we'll definitely talk to you soon.
All right, thanks.